Let's talk of bacterial vaginosis. New research now reveals that bacterial vaginosis affects 1 in 3 women and is likely to be sexually transmitted. Let's start evaluating what more we know. What is bacterial vaginosis? It's the most common vaginal infection. Approximately 30% of reproductive aged women get affected by it, making it the most common cause of vaginal discharge. It disrupts the microbiome and the protective lactobacillus bacteria and the overgrowth of harmful anaerobic bacteria like Gardnerella start coming up. And often it's silent. 50 to 70% of women with BV experience no symptoms, making it easy to miss without regular testing. What are the signs and symptoms? Unusual discharge, thin grayish discharge, which may be more noticeable after sex or during menstruation, distinct odor, a fishy smell that becomes stronger after intercourse or during menstruation, and discomfort or vaginal itching. Diagnosis typically involves clinical evaluation using the Amstel criteria and laboratory methods looking at characteristics. Why does it matter? One, it causes pregnancy complication and increases the risk of preterm labor and miscarriage in pregnant women, increase the risk of sexually transmitted infections, and they may have some fertility impact. BV is likely to be sexually transmitted, and scientists now consider BV as an STI based on transmission. Partner treatment tends to work, and there are some guideline changes. What are the treatments? And the treatments are standard antibiotics, which are oral metronidazole or transvaginal clindamycin, remaining as a first line of treatment, but recurrence rate reach 50% within 6 months. Probiotic and microbiome restoration, oral and vaginal probiotics may be helpful, and there's a role of personal DNA testing, including the new PCR tests. Phage therapy and immunotherapy are again being considered, and these are quite new strategies. If you look at the other guidelines, we'll say look at partner treatment, probiotics, non-immune therapies, which are coming up, smart drug therapies, personal DNA testing, and certain emerging therapies like in this list. Strategies that work are gentle hygiene, use of plain water and mild soap for gentle hygiene, avoid perfume products or douching and strong detergents, safer sexual practices, and regular checkups. Taking control of the health, and remember, a third of women may be affected, but is often misunderstood. There's new research confirming it's likely sexual transmission, and partners should be treated. Do not ignore an unusual discharge or odor. Speak with your healthcare professional and have treatment options. Thank you.